Welcome to today's video on Revive Therapy, which is it's not physical. Many people struggle with sexual issues and anxiety and ask, is something wrong with me? And more importantly, can cognitive hypnotherapy actually help with this? The answer is yes, but not for the reason that most people think. Sexual issues are not often purely physical. They are often connected to anxiety, performance issues, subconscious patterns. And at the core of anxiety is this: I don't feel in control of what's happening in the present moment or what's happening now. And nowhere is that loss of control felt more intensely or more strongly than during intimacy. Some of the most common issues that we see sexually are among erectile dysfunction, premature ejaculation, delayed ejaculation, low libido, vaginismus, painful intercourse, performance anxiety, intimacy avoidance, compulsive sexual behaviors, and sexual shame. While these may look different on the surface, they are often driven by similar subconscious patterns. Now, there's an anxiety connection to sexual performance, and sexual performance requires presence, relaxation, connection. Anxiety does the opposite. It creates tension, overthinking, self-monitoring, and pressure to perform. So instead of performing in the present moment, being in the present moment, the person is stuck overthinking the should have, could have, would have, or what might happen. Thinking things like, am I doing this right? What if I fail? What if I lose control? That pressure alone disrupts arousal, performance, connection. So why does this become a pattern? The brain learns quickly, especially through repetition. One negative experience can create anticipation, fear, and a conditioned response. So next time, the body and the mind even react before anything even happens. This creates a loop: anxiety to performance issue, and performance issue to more anxiety. And over time, this becomes automatic. What cognitive hypnotherapy targets and works at the level of is the subconscious emotional patterns. It helps address performance anxiety, conditioned fear responses, shame-based beliefs, past experiences, and emotional triggers. Instead of trying to force performance, we change the internal experience that's driving the behavior. Now, some cases are connected to sexual trauma, negative past experiences, but many are connected to small t's, or what we call the small traumas. These examples include embarrassment, rejection, criticism, and early negative experiences. These experiences shape confidence, safety, and emotional responses, and often operate below conscious awareness. Healthy sexual function requires relaxation, safety, and emotional regulation. When anxiety is present, the body and the mind shift to a stress response, a sympathetic nervous system activation, the fight or flight, and the body can't be in survival mode and intimacy mode at the same time. Now, anxiety is the feeling of not being in control of the present. So the mind tries to control everything: performance, outcome, perception, but that creates even more pressure. The solution is to take control of what you can and let go of what you cannot control. Easier said than done, of course. So what can you control? Your breathing, your presence, your awareness. What you cannot control: perfection, outcome, external validation. What cognitive hypnotherapy actually does is, and don't mistake this for being a quick fix or a magic wand type of magic, it is structured work just like psychotherapy, involving cognition, emotions, and behavior. They're just done faster, quicker, and more efficiently. We work on subconscious triggers, emotional responses, belief systems, identity patterns, and as those patterns shift, anxiety decreases, confidence increases, and performance becomes natural again. The traditional approaches, they focus technique, performance, surface level strategies. Cognitive hypnotherapy focuses on the root cause, which is why it often helps when other approaches have lagged behind and have not worked. If you've been struggling with sexual issues and feel like you're too much in your head or stuck in a pattern that you can't break, probably not a physical problem. It's probably an anxiety driven pattern. And that's exactly what cognitive hypnotherapy can address directly at the subconscious level, at the core. Have you ever felt performance anxiety or pressure during intimacy? Did it feel more mental than physical? What helped? What didn't? Leave your thoughts in the comments. These conversations help people more than you think. Until the next video, and thank you for watching.